County's first medical marijuana dispensary opened last week on Jacksonville's Southside. Then the Orange Park Planning and Zoning Board voted 3-1 to recommend that the town council consider a medical marijuana dispensary. Now, you might have questions if you're in pain and you're considering getting a medical marijuana card. So we asked some of you to send us your questions this morning. And joining me now is Dr. Saman Soleymani from Avicenna Medical with some of those answers. First of all, I want to ask you the question about what's really on the approved list. What are the diagnoses that can help you get this card?
There are several diagnoses that are actually listed in the legislature, and that includes ALS, which is amyotrophic sclerosis, cancer, HIV, AIDS, post-traumatic stress disorder, epilepsy, glaucoma, chronic non-malignant pain, obviously if you have any malignancies or cancer. They've also left a category that essentially says, because out of the thousands of diagnoses that really cause pain or decrease quality of life, it would be very hard to list every single one of them individually.
Absolutely.
So there's a category that says any other qualifying conditions that may be similar to those that I just listed that a doctor may feel that you may benefit from medical cannabis therapy.
So you can't just, okay, here's the thing. I've been in other states where, you know, it's been legalized for medical purposes and it says get your card here and it looks like you can just walk in and, you know, get a card. It does not work that way here.
No, it does not.
So what is the process for getting the card here?
So if a patient, let's say, called our center, they would have to bring documentation of whatever ailment that they're suffering from. So that's the number one question. Is this covered? Does this qualify? So again, you got to refer to that list and anything that the patient may think may be similar, and then obviously we can evaluate it to see, but they have to bring documentation. So you just can't walk in and say, oh, I have back pain, or oh, I'm anxious at night, or I can't sleep at night. Hand me my medical cannabis card. And there is no, and again, another misconception is that there's actually a prescription or a card that the physician actually hands out. That is not correct. We make the recommendation. If the patient qualifies, then I would enter that patient into the statewide registry system and recommend what their daily and monthly dosage would be. At that point, the state sends the patient an email. The patient has to register on that registry site themselves. They have to send a payment to the state for the state to finish registering them. And within 10 to 14 days, the patient receives an email with a temporary medical cannabis card. And with that, they can call any of the state-approved dispensaries and purchase their medical cannabis.
Purchase that.
And then in about a month, they will actually receive a physical card. But there is no prescription. There's nothing that a physician would hand out to say, hey, this is your ticket to go and get medical cannabis.
So it's still going to take weeks after you...
About 2 weeks. Within 2 weeks of seeing your physician, they should have the email, and with that temporary email registration card, they're able to start their treatment.
All right, we have some questions from that some people sent in. One says, I have a bulging and a herniated disc. Sometimes at night the pain is so severe I can't sleep. I do not want to take pain pills. Would medical marijuana help me?
For sure it can. I mean, it's the use of medical cannabis for chronic non-malignant pain is well documented. We have patients that have been on high dosage of opiates in the past, and opiates have their own side effects, whether it's constipation, addiction, severe withdrawals, and so on. And medical cannabis definitely would qualify for that. Obviously, there has to be documentation that there is bulging or herniation of discs
and serious pain. All right, here's another one. If you've been given a prescription for medical marijuana by your doctor, will you be protected from being fired by employers who do random drug testing for using marijuana? That's a great question.
You're not protected. It's companies can set their own policies. It's literally almost no different than you can have a concealed weapons license that is issued by the state, but if your company does not have a policy that allows you to bring that, you still have to go with the company's policies.
All right, I know you kind of answered this question before, but this says, you know, can you get it if you have a progressive, incurable disease that causes you a lot of pain?
Oh, for sure.
Or is it only for people who are terminally ill? This is from someone who's 31 and just is afraid of painkillers.
Well, you know, so many people still think of how the laws and legislatures were even as recent as 3 to 6 months ago, where it was short of having a really terminal illness, cancer, AIDS, you really didn't qualify. Now, the diagnosis list have been expanded to other debilitating disease that decrease the quality of life, but they're not per se terminal. But to answer this person's question, if you definitely have a terminal disease and you have pain, you definitely would qualify.
So when you go to these facilities, what are the types of medical marijuana that you're getting? Because I think a lot of people have the idea that they're, going to have to smoke it, and because that's what they're most familiar with. It comes in a lot of other forms.
Smoking is not even allowed in the state of Florida. The only per se smoking would be a vaporization. So it does. So the forms that are currently available that are approved, and I don't see it change any foreseeable future for at least a couple of years. It's available in a suppository format. It's available in capsules that you can swallow like a pill. It's available in oral tinctures and oils, and it's topical creams for people that have very localized joint or musculoskeletal type pain. It's also available in oil cartridges that can be inhaled as a vaporizer, but the actual flower or bud cannot be, as what a lot of people think, cannot be smoked or burned per se.
And we're out of time, but I have to ask you this one last quick question. This also isn't the type of marijuana that gets you high. This is a different type of treatment.
They have different strains. They have strains for, let's say, nighttime for a lot of pain that does cause euphoria and sleepiness that some people will need, but they also have strains that are high CBD, low THC that does not cause a euphoria.
That just helps with the pain.
Yes.
All right, thank you so much, Dr. Saman Soleymani. We appreciate it. If you'd like to share this interview, we're going to post it on news4jax.com's morning show. Vic?